I'm Russ Freeland. I'm an equine surgeon at Haggard Equine Medical Institute. Lameness issues in older horses are often an issue that people face that often is associated with arthritis. Arthritis can occur in any joint and oftentimes gets worse with age. It can be a performance limiting issue, and even in the aged horse be a limiting issue in terms of quality of life and affect pasture soundness. Arthritis essentially is a manifestation of inflammation within the joint that typically will get worse with age as wear and tear occurs within those joints, and ultimately will create issues with riding soundness as well as pasture soundness. Osteoarthritis is a manifestation of chronic inflammation within the joint. Typically, inflammation within the joint starts out as synovitis or inflammation of the joint lining. Ultimately, if that synovitis persists within the joint for a long enough period of time, degenerative changes within the joint can progress to osteoarthritis, which affects the cartilage, the joint capsule, the surrounding soft tissue structures, as well as the underlying bone. That process typically is a progressive issue that, of course, affects the way the horse moves and ultimately its quality of life. Osteoarthritis in the horse often will initially present with subtle lameness. That lameness may be presented under saddle as well as ultimately just on pasture. It often waxes and wanes with time. Depending upon the joint, it may improve with exercise and movement. Some joints do tend to get worse with exercise as well, but ultimately owners will see a progression of lameness that once may be very subtle coming out of the stall, that ultimately will become pretty consistent under all gaits and every day. And yeah, that usually will progress with time as the horse ages and more wear and tear is present within the joint. Initially, horse owners will often see subtle lameness that will often progress as evidence of difficulty standing or rising from laying down, reluctance to trot, canter. They may ultimately appreciate swelling in the area of the joint or enlargement of the joint, such as in bone spavin in the hock. Sort of an enlargement and boxy appearance of the lower hock joints may be prominent. Similar would be ring bone, arthritis within the pastern. Owners may appreciate some sort of swelling, ultimately bony swelling within that area that you can see and feel. That is a long-term chronic progression of the disease. Initially, though, mild lameness is noted, and it may be mild and self-limiting and often will progress to lameness even noted on pasture. Younger horses tend to have more acute injuries that are associated with trauma or overuse injuries. These issues often present acute lameness, whereas the horse was normal the day prior with no history of lameness. There may be swelling in the area, maybe more so than the aged horse that has osteoarthritis, which is more of a progressive, subtle disease. And often the aged horse will wax and wane, whereas the young horse will be lame that day, and depending upon what's going on for several days in a row, that will ultimately make the owner want to call the veterinarian. Whereas the aged horse with osteoarthritis, they will wax and wane, and it's not until several months down the road that the owner finally calls the veterinarian because they appreciate either a worsening of the lameness or some sort of performance limiting aspect of the lameness. In aged horses, we definitely see other things than osteoarthritis. We see all of the trauma things that we see in young horses as well, whether that's acute pasture injuries or performance injuries such as soft tissue injuries, tendon injuries, suspensory injuries. We also see manifestation of injuries from younger in life, re-injuries such as a tendon bow. We often see those come into play even if the horse isn't being used. They can re-injure tendons on pasture. They can also develop degenerative diseases such as suspensory ligament desmitis. That can progress with life. It may have a conformation and genetic component to it. We don't see those things in young horses. That's more of an age degenerative type of disease. As horses age, they tend to have less ability to repair themselves and heal themselves, just like you and I. Everything tends to take longer to get better. So we do have to be more patient with those patients and appreciate that there is high risk of re-injury for several things that we will rehab successfully. Most things do get better with time, though the risk of re-injury as the horse ages is probably higher and ultimately will be performance limiting. In terms of aged horses, we see more and more that clients are keeping their horses on daily nonsteroidals, such as firocoxib, which is an anti-inflammatory. In the aged horse, this tool can be very helpful for daily use for mild osteoarthritis. We have to keep in mind, though, that these medications can have side effects. And as we're learning more about those side effects, it's probably important to have a veterinarian evaluate those horses at least annually and do blood work if they think it's indicated to make sure the horse is handling those medications appropriately.